Hi everyone, Shanda Demarest here.
Hi, my name is Teddy Potter.
Hi, I'm Andrew Jensen.
My name is Jessica LeClaire.
My name is Katie Carey.
My name is Julia Ryder.
And I'm a nurse climate champion.
And I am a nurse climate champion.
And I am a nurse climate champion.
Healthy people need a healthy planet, and right now our planet is very sick. And that's why I became a nurse climate champion.
I'm a nurse climate champion because in my role as a cardiac nurse, I've seen firsthand all of the patients here, even in Minneapolis, Minnesota, who during the summer months are seeing worsening in conditions like heart failure, COPD, asthma.
We also know that on days with elevated particle pollution, the incidence of patients coming to the emergency department and being admitted for myocardial infarctions or heart attacks rises.
Our winters are changing, our summers are changing, our rain patterns are changing, and this is leading to a sense of unease and despair in people.
As a nurse, I'm concerned about the health of individuals and communities, especially those that are more vulnerable with fewer resources.
I have seen increases in early onset asthma in children living in low-income housing, where the basements have been boarded up due to the frequent flooding and the subsequent toxic molds.
I've noticed over the past 2 years a lot of different ways that our clinic could improve on in ways to help combat climate change.
When I learned that climate change was the #1 threat to human health of the 21st century, I knew I had to do something.
I think that most of our staff, are becoming more and more aware of what climate change means and that there is an impact on patients, but what I found was that they really needed an opportunity to figure out how it's really impacting our patients here at Lakeview.
I felt that over time there were very few resources for public health nurses to effectively make a difference.
And so I joined up with Healthcare Without Harm, an alliance of nurses for healthy environments, to build the Nurses Climate Challenge, to rally my fellow nurses and my nurse allies around the country and really around the world.
I decided to join the Nurses Climate Challenge because nurses are a trusted voice to deliver the truth, and we are 3.9 million strong in the United States, so that's a lot of voices to share the impact of climate on health.
The tools and resources are easy to use, and they give me a way to easily talk with my peers and colleagues.
The Nurses Climate Challenge makes my job so much easier in convincing the nursing students that they can do this work. And in fact, I have a few students so far who have also joined the Nurses Climate Challenge and have educated their preceptors and other nurse colleagues at their clinical sites.
And so I urge all of you to raise your voices to launch a movement of health professionals to commit to a climate solutions in our hospitals and our communities.
So join us.
Join the Nurses Climate Challenge.
Join the Nurses Climate Movement.
Join me and my fellow champions who are committed to climate solutions.
Together, our voices can be the voices of change and a hopeful future for our community, our patients, and our loved ones.